What can you tell us about the theme of this MLI paper?
Well, the piece that I wrote was really focused on, I guess, the area that I like working in the most, and that is how do you pay for the system? And I think that we're specifically focused on is that there'll always be a public portion to healthcare. In Canada, the government covers about 70% of the cost of healthcare services for Canadians, which is actually a bit lower than you find in Europe, and it's more than what you find in United States. But the main point is that it's not going to disappear. And so the question is, how do we fund that? What's the best way of funding healthcare that the government provides to our to Canadians?
And what was your conclusion?
Well, I thought the Mazankowski report had a very good discussion of alternative measures. They discussed premiums, for example. At the time of the Mazankowski report, when it was issued, Alberta did have a healthcare premium. It also discussed other options, such as medical savings accounts, which we can get into some more detail afterwards. Also, what are called variable premiums, and even having dedicated taxes like an HST, et cetera. And what you do find today in Canada is that almost all of healthcare is just paid from general revenues, which is similar to the United Kingdom, but most other countries have some sort of dedicated revenue that goes to healthcare, including some incentive-based ones.
Now, let's just stick a pin in that just for a second. Obviously, Don Mazankowski, our viewers may not know, but he's a former deputy prime minister under the Brian Mulroney government of the 1980s and early 1990s, and he was commissioned to do this kind of future of healthcare report. I guess, was it in the late 90s or somewhere in there anyway? And from that came a series of recommendations. So you're kind of analyzing that and saying maybe he was slightly ahead of his time. Is that right?
Well, I think he was probably not ahead of his time. It's just the question is whether Canadians are ever going to be willing to look at some alternatives. It did come out, that report, around, I forget exactly the year, but it was kind of around 2001 or whatever. And it was also at the same time that the Romano report came out. This was one that was commissioned by the federal government, which Roy Romano, who used to be the premier of Saskatchewan, had put together a major report on healthcare reform as well. And so we had both of these reports out at the same time, and they did take quite different points of view, especially on the funding recommendations that I talk about in my paper.
COVID has been the icing on the cake a little bit here. It's a crisis that is with us now, but I guess your point of view is this crisis is a long time in coming, yes?
Well, back at the time of Mazankowski and the year and 2000, expenditures in healthcare were rising quite rapidly, actually. Of course, we had relatively higher inflation going into the early 90s, and that was one of the reasons, but also the population was starting to age more quickly, and there were more people requiring healthcare services. And so it wasn't unusual for healthcare expenditures to rise, 6-7% per year. In fact, that went on even after the two reports were issued. It wasn't until we got to after the financial crisis in 2008 and the recession that followed in 2009 that we started to really see provinces control costs much more with healthcare. And in fact, the healthcare costs have not been rising as quickly as they used to be. But for all the provinces, healthcare is the biggest department and source of expenditure that governments make.
Jack, we're just going to take a brief break. I'm sorry to break in like that, but we'll take a brief break for commercial. We'll be right back with you.